Fine. Okay, hello everybody. Thanks a million for coming on to our new webinar series. So this is our 6th episode of our webinar series for our low back pain. We're going to be talking about low back pain and exercise in the Asian workforce. And I've actually changed the name. So I was talking to a colleague of mine about the title of this, and actually myself were discussing this, and the term Asian probably wasn't the best.
Why can't I see anything? I can't hear anything now.
Generalization. And then we have the mean population will rise from 39 to 44 by 2015. So this is by the Health and Safety Executive. So in 2008 they done the survey where we're going to raise the average age going to raise to 34 years by the year 2050. You can see also that it all kind of correlates. So we have those aged under 45 will rise by 2.7 million. However, those aged over 45 will raise by nearly 8 million, which by unison. So that's a huge rise. And then this is a US statistic that the number of workers over 55, and this is what we classify as mature in age, over 55 years old will be increased by a huge amount, which is 49%. And that's from the period of 98 to 2008. So as an overall, we're getting older, and what we need now is how we can manage ourselves to keep as healthy as we can as we get older. So there are definitely benefits to a maturing workforce and some myths definitely need to be dispelled about this. And one of them is that we are regarded as a valuable asset. So that means most employers regard mature workers as a valuable asset without doubt. And the reason for this would be the obvious, I suppose, is that the Asian workforce, the experience and the knowledge that they have to that role. It is also argued that the mature workforce is more reliable and competent. But it still brings up a kind of a key question that we hear, and that is age an independent risk factor for work-related musculoskeletal disorders? And it's an interesting question. That does age directly affect us getting musculoskeletal disorders such as low back pain, knee injuries, osteoarthritis, those different types of injuries that we see commonly. Interestingly, just a couple of days ago, I done a Twitter on our Twitter account. And you can see that I asked people, and this was clinicians and patients just answering. So, did they believe that musculoskeletal disorders was a risk factor in the workplace? And we can see it's not a massive poll, but we had 86% saying yes, and no was 14%. Now I do have a poll attached to this webinar, so if you guys have your tool menu to the right hand side, you'll see there is a poll that you can select, and it just says, in your opinion, is age an independent risk factor for musculoskeletal injuries in the workplace? You can answer that now if you can, or you can answer through the webinar, or you can answer at the end of the webinar. But if everybody can answer, that'd be great, just as a bit of an insight. but I'm going to give you the answer to it in a second, so it'd be better to answer it now. And I suppose the reason why a lot of people think that age is a risk factor would be probably related to these facts, is that some researchers, Benjamin and Wilson, done a survey amongst employers and employees just to see what the common beliefs were about a maturing workforce. And it is very interesting, you can see, is that most people believed that within an aging workforce there was increased illness and disease. There was less of cognitive capacity, so change in memory or difficulty in learning new skills and things like that, they believed. There was less physical strength, and they believed. More time off sick was a big one. Increased accidents in the workplace as well. And finally, there was that the mature workforce was less productive. So if we were to believe all these, or we were to read all these and take these for granted, we would say, well then, age is a risk factor for musculoskeletal disorders. But the truth is that it's not. So the question is maturing age a risk factor for musculoskeletal disorders? And the answer is no. And this is a really important message to portray it and to educate everybody, and especially employers and employees. So what we do know is that within an aging workforce, that our functional capacity will reduce slightly, and that means our ability to kind of walk a long period of time, or repetitive movements, bend forwards, or sit and stand and go upstairs. That's all your functional capacity, and that does decline as we get older to a certain degree. But that's not influenced by age as such. That's more influenced by things like genetics, or our general lifestyle, how we eat and how we exercise, and also our working environment. So that would be our relationship with our employers, if we have an autonomic role in work, if we had access to medical facilities, those type of things are more influenced by our functional capacity. So I'm going to kind of continue on what the more interesting side of the facts is with a maturing workforce, and that is there's less frequency of absence. So this is really interesting, actually. So if we were to go by recent research, it was by researchers called Bardum and Begum, and they basically had stated in their research that overall, the majority of overall absence is due to short-term absence. So most of this absence is due to short-term. However, in the maturing workforce, there's a less incidence of short-term absence, and there's a higher incidence of long-term absence. So due to the fact that maturing workforce have less incidence of short-term absence, therefore aging workforce contributes to less overall frequency of absence. So the myth that there's more sickness in the maturing workforce is false. What we do know, as I said, the functional capacity reduces, and that we do need increase, or the maturing workforce needs increased recovery rates. And that simply means that, when you're in your teens, your 20s, your 30s, you can possibly work for more repetitive or longer periods of time without as much recovery. As we kind of get older through life, we do need more recovery, and that's an important factor for both the employer and the employee. So things like rotating job tasks around, providing kind of breaks in between the heavier manual tasks in between, possibly changing shifts to part-time shifts as we get into our mature years. Things like that will help improve our recovery rates, and that will therefore reduce your risk of musculoskeletal disorders. And very importantly, we know that there's a higher incidence of musculoskeletal disorders in those where there's a failure to match their employees' functional capacity to the actual demands of the job that they do. So that's important from our point of view, from health professionals, is that we need to be able to assess the employees, their functional capacity. We need to be able to assess what the demands of the job is, and we need to be able to match the employee to the job. So obviously they're not doing a job that's outside their functional capacity. And if we do give them a job that's outside their functional capacity, well then we are going to increase the risk of musculoskeletal disorders. That's a quick overview. So what I'm going to do is I'm going to quickly introduce Hazel, who's our clinical specialist physiotherapist. Hazel, do you want to give yourself a little background into yourself?
Hello. Well, my name is Hazel Rudder. I've only just started working for IPRS as a clinical auditor in April. And prior to that, I've been a physio within the NHS for 17 years. 8 of those was as a clinical specialist in spinal rehabilitation, before sort of working more generically in musculoskeletal CMATS clinics. So yeah, my MSc was in musculoskeletal physiotherapy, and specifically my dissertation was on exercise and low back pain. So this is quite an interesting area for me. So Paul's got a few questions regarding sort of myths or beliefs that people have with back pain as they get older. So
yeah, so we always get kind of common questions asked in regards to this area. So we picked out some of the more common questions that we get asked that Hazel can possibly answer. And the first question we get asked is, and I think as an example, is I have a history of general back pain which affects my work from time to time. So should I expect my back pain to gradually get worse as I get older?
Okay, so that's the question that's often asked, isn't it? That should I be doing a bit less now because I have back pain? Is it going to make it worse? I think a lot of the language that is used as people get older, if they have back pains, words like degenerative or crumbling I've come across that have been used by medical professionals to describe normal age-related wear and tear changes are very unhelpful in just setting the right kind of psychological approach to the back pain in the patients. But yeah, there will be normal age-related changes in the spine. That doesn't necessarily mean there will be more pain. We know that discs dehydrate over time, but the evidence is that they actually become less painful as people get older if they have a pre-existing disc problem as the disc dehydrates. So it's really important that people know how to cope with an acute episode of low back pain, because obviously if you deal with it well in the initial phases, you're going to be off for less time and it's going to be a problem for less time. And you should be able to remain in work if you're dealing with things properly, so that it doesn't become a chronic problem with barriers to returning to work. So people need to take a bit of responsibility if it is affecting their work, if there's a particular task or ergonomic feature that is tending to predispose people to a problem. Likelihood is it's not just going to be them affected. So there's a responsibility on that person to report any sort of musculoskeletal injuries to their employer. And likewise, then the employer has an obligation to look into and risk assess any sort of factors that may be causing their employees musculoskeletal injuries regardless of their age, but the responsibility needs to be on both to actually report things so that modifications can be made or alterations made and risk assessments carried out that will help people to cope with back problems, because it won't necessarily be the fact that somebody is getting older. It may just be that the process of what they're doing needs changing. So
yeah, it's great. So just matching their capabilities to their demands.
yeah, definitely. And you know, there's lots of advice on like the HSC websites that help people sort of deal specifically with back pain. So advice regarding their ergonomics, their work pacing, how to sit properly, the DSE sort of assessments, how to vary the tasks and pace things better. But it's a two-way process. It's something that both the employee and the employer needs to take on board.
Definitely, yeah.
And
Great.
then obviously,
Perfect, thanks, Hazel. So the next question is, I'm over 50 and I get intermittent back pain that I can self-manage. Should I gradually reduce my exercise to reduce the wear and tear on my back?
okay. So a typical response to people who experience back pain is to take it easy during those episodes. And obviously we know now that this is not the right thing to do, and that resting for more than a day or two will actually undermine the healing process. So active forms of exercise are really necessary to make sure that your back is strong, and to help alleviate pain even in quite the early stages of back pain. So we know from studies that have been done in physiology that by doing exercise and fitness activities, you are keeping your back healthy by allowing your discs to exchange fluid, which is how your discs get their nutrition. So a healthy disc will swell with water and squeeze it out, similar to the action of a sponge. And again, exercising the back will help with that process. And interestingly, when I was a student physio, there was this sort of myth almost that discs really dehydrate, and by the time you're 50, there's no water left in them. But having worked with a spinal surgeon, that's certainly not the case, and certainly into people's 60s and 70s, there is this fluid available within the discs, which will be a help with sort of lubrication of the back when it's exercised. And also then you're reducing stiffness by doing exercise, by stretching the ligaments, keeping the tendons flexible. And if you have good mobility in your spine through doing lots of exercise, your connective fibers in these tissues are much more used then to the stresses that are put through them, so you're less likely to injure them through a sudden movement or a sudden jarring. And then obviously you've got the effect of strengthening and repairing muscles that help support the back. Everyone talks about the core, so your back and abdominal muscles acting as a corset to support the discs, the joints and the ligaments. And then just through doing some general movement, you'll be lubricating the joints of the spine, which again is how the joints get their nutrition and how they stay healthy. So another consideration in your aging workforce, particularly if you're female, is osteoporosis. And again, weight bearing, gentle exercise is the way to sort of help preserve bone density. So yeah, there's lots of recommendations from the World Health Organization that you should be doing 150 minutes of moderate aerobic exercise every week, and strength exercises 2 days a week. I'm not sure if how many of us are actually doing that. And the World Health Organization also recommends that you're walking around 10,000 steps a day, which if you put a pedometer on, most of us do about 3,000 to 4,000 just doing daily activities. But unless you significantly go for a brisk walk, you're not going to be coming near what the World Health Organization are asking you to do. So
yeah, and our good guidelines to go by that, like just thinking of keeping 150 minutes of aerobic exercise a day. Don't confuse that it has to be going to the gym to do intense exercise, or doing some sports that you haven't done in years. It can be something very simple to, as Hazel said, going for a brisk walk to elevate your breathing a little bit more, going for a cycle. It doesn't have to be anything too intense as such.
yeah, absolutely.
Perfect. Okay.
And it's been shown as well that it works better if you're doing it in, say, 5 30-minute sessions of exercise during the week, whether that is a brisk walk, than people who kind of save up that allocation and then suddenly, do something really hard and really vigorous, because you don't tend to get the overflow from that activity. You're better doing little and often than kind of thinking, right, it's Sunday afternoon, I'm going to go for a massive run. You get much more carryover if you're doing little and often.
Yeah, it's great. Thanks, Hazel. Okay, last question. So what is the best advice you can give to help prevent my back pain from getting worse as I get older? We've kind of covered most of it, but as an overview.
Kind of covered the sort of exercise side of things. So there are recommendations as well for, your less impact exercises like Tai Chi and yoga, particularly with regards to just keeping flexibility, strength, lubricating those joints, and they're sort of quite gentle on the rest of your body. Eating a healthy diet is very important as well. When you think of the forces that are going through your spine, obviously the heavier you are, the more weight and the more strain is going through your spine. And again, going back to kind of your female older worker, you wanting to prevent osteoporosis, so calcium and vitamin D is quite an important consideration. One of the big kind of advisory things the consultant I used to work with used to say was that smoking is actually massive in terms of a contributing factor to back pain. So obviously smoking doesn't directly cause the back pain, but it does affect your blood supply into the discs, and it affects your healing process. And smokers have a 300% greater incidence of chronic low back pain than a non-smoking population. So that would be one of the major things. If you are a smoker, then giving up smoking would have a huge influence potentially on your pain, improving the health of your actual spine, and sort of keeping it more healthy for the future. So that would be sort of two of the things. So exercise, diet, and smoking. And then going back to kind of the work considerations, it's taking some responsibility, looking at your working practice and looking at your ergonomics, how you're doing things. Is your posture good? If you're lifting loads, how often are you doing that? Can it be made easier? Has somebody risk assessed it? So it's not just the older population. The breadth of this covers the whole population as a whole. But I think as you're getting older and maybe a bit more mindful of your body, what you might want to do to keep things healthy, then those are the things to be considering.
Definitely, and this is the point of this webinar. Is not just for people who are over a certain age. It's for people, employees and general people who are of younger, and just it's a good insight into how they can prevent this low back pain or musculoskeletal disorders in the future. Definitely, it's important to take on this advice really.
Yeah. So it's not just your older person. Just every one of us could probably do a bit more.
Yes, exactly. Thanks for Hazel. That's really insightful. That's brilliant. Hazel's going to give us a little bit of some information and resources for further information at the end of this webinar. I'm going to have a little chat, or my colleague Ashley here is going to have a little bit of chat with one of our employees up in the Getrag manufacturing plant, who is Robbie. Robbie, how are you doing? Do you want to give yourself a brief introduction, and Ashley, you can take over.
Hiya, Paul. Okay, my name's Robbie Fawn, and I run the EDAP Centre at the Getrag manufacturing plant up in Halewood in Liverpool. I played football to a high level, and I still enjoy regular exercise. And I'm dedicated really to improving the health and the well-being of the staff members at Getrag. I cycle to work, to and from work most days, and I keep myself generally fit. I'm over 50, and I'm glad to help you out today.
Great. Ashley has a couple of questions. Ashley, do you want to fire away the questions there?
Yeah. I'll fire away with the questions. Let me just get them up. That would help, wouldn't it? So as well, that was brilliant from Hazel, by the way. She was really good there, Hazel. I really enjoyed that, and it made me feel really bad about not doing 150 steps a day.
Thank you.
10,000 steps a day and going to the gym. So I'm sure Robbie's about to make me feel 10 times worse about not cycling to work every day. So, Robbie, the first question I've got for you is, how long have you been training for, really? And I know in the past you've had issues with your lower back, so how has exercise helped you in the past to overcome that injury?
Yeah, Ash, I've been exercising all my life, really, from a very young age. Right through school, I played sports such as football, basketball, hockey, tennis, athletics, and golf. After leaving school, my exercise continued mainly with me football and golf. And going to the gym 4 or 5 times a week, I used to do my circuit training classes and weight training. This exercise, it's continued into my 50s, and as I'm approaching my 53rd birthday in a few weeks' time,
Don't look a day over 20, Robbie.
Thanks very much, Ash. I feel as fit and healthy as I did sort of 30 years ago. And what I have increased more is my flexibility exercises, to be fair. Probably since the age of 40. I have felt my muscles do tighten up more quickly and they do take longer to recover after exercise. But I believe I exercise all my life, and as I'm getting older, increasing my stretching exercise has really helped me stay injury-free. Although I have picked up slight muscle strains and the odd ligament strain every now and again, I feel by keeping my muscles active and strong, they've really protected my joints and therefore reduced the risk of injury.
That's really interesting, and ties in quite nicely what Hazel was saying about, you know, that movement being important and keeping the flexibility in the spine as well as the strength.
Definitely, Ash, and just to sort of speak a little bit about what Hazel was on about with lower back pain. I suffered a prolapse disc when I was 25, so 27 years ago now, and I struggled for a few years after that. I sort of had to pack me semi-pro football in. And I got back playing again 5 years later, and that was just with my mates and stuff. But I felt next 10 or 15 years I struggled with my back. I didn't know a lot about the human body, how it worked. And over the last sort of 10 years or so, I've learned a lot more about the human body and qualified in a bit of personal training and sports therapy. So I've learned a lot, and I feel coming into my 50s, my back has been probably stronger now than it's ever been. And that's just by exercise and doing all my weight training. Not so much cardio stuff nowadays, but a lot of weight training, a lot of core exercises to strengthen everything up. I still suffer with aches and pains here and there, especially of a morning. It's quite stiff and tight. But once I'm up and about moving, my back it really is. It's as a 53-year-old, I feel it's in better shape than definitely a lot of 20 to 30-year-olds. And there's no reason in saying I can keep it at that level. I can keep it strong over the next 10, 15, 20, 30 years while I'm exercising, doing the right things, yeah.
That ties into the next question. My next question is, do you find that age is a barrier to challenging yourself physically? And I think from what you've said, it doesn't seem that way.
No, definitely not. In my opinion, as we get older, we understand our bodies don't recover as quickly, and we can't be overusing our muscles. But if we plan our workouts in advance, I feel, and our diet are adequate for our needs, there's no barrier to challenging ourselves physically. As long as we eat healthy, drink plenty of water, and very importantly, in my opinion, sleep well, age should not come into the equation as a barrier. Again, by stretching regularly, eating and drinking the right things before and after exercise, there shouldn't be no barrier in what we can achieve. I've learned to work out smarter as I'm aging and introducing more cross-training, sort of biking and swimming and stretching to avoid injuries. These are very important to exercise, I feel. And by not exercising the same muscles all the time, again, it'll reduce the risk of injury.
That's oh, sorry, Robbie.
Yeah, sorry. Yeah, and if we can find time to challenge ourselves physically, there's no age limit in what we can achieve. I identify 3 1-hour slots a week for my physical activity, and that's as well as me biking and me sort of football I play still. And I feel that 50 is the new 40, as a lot of people say nowadays.
Sounds like 50 is the new 30 to me.
Well, yeah. And it just shows people nowadays are generally living longer, aren't they, than the parents and grandparents. So remember, yeah, age is definitely no barrier.
That's a great message there, Robbie. And I think you probably already answered the last question, actually, but it's, do you feel being active has an effect on your well-being as someone who's just over 50? Thanks, Ash, with the just 3 years just actually over 50, but that'll do for me just. But no. To answer your question, definitely as we grow older, an active lifestyle is more important than ever. Regular exercise can help boost your energy levels, it can maintain your independence, and manage symptoms of illness and pain. And exercise can reverse some of the symptoms of aging, as we know,
And not only is exercise good for your body, it's good for your mind, your mood, and your memory. Whether you're generally healthy or managing an illness, there are plenty of ways we can get more active. Improve confidence, boost the fitness, and improve your overall sense of well-being. Exercise and strength training helps you look younger. Thanks, Ash, for the comment there, yeah. And stay active longer. And we all know that regular physical activity lowers your risk for a variety of conditions, including Alzheimer's and dementia, certain cancers, high blood pressure, and obesity. Not only can exercise help stem the decline in strength and vitality that comes with age, it even improves it. And the mood benefits of exercise can just be as great as 70 or 80 years of age as they were at 20 or 30. So you're never too old to exercise and improve your well-being. Being active for over 50s adds extra years to your life. But it's not just about adding years to your life, Ash. It's about adding life to your years. You not only look better the more you're active, you'll feel sharper, more energetic, and I feel an even greater experience and sense of well-being.
I don't think I could have said it better myself, Robbie. Thanks very much for that, mate. Thanks very much for your time and effort.
Thank you, Ash, and thanks for listening. Thank you.
Thanks a million, Robbie. That's great. That's good, inspiring story there. So kind of following up from what Robbie was saying, actually, is that there was an interesting article in the Times magazine in, it was only last month, I think it was, or a couple of months ago, and they basically just marked it as the miracle cure for musculoskeletal disorders. And again, sorry if I haven't been clear in this, musculoskeletal disorders being anything that affects muscles, bones, soft tissue like low back pain, for example. And the miracle cure, we're all looking for a miracle cure. Everybody wants that secret pill that can just make us much better, healthier, happier. And what we've concluded through all the research is the one thing that we can definitely say, without a doubt, is the miracle cure is what Robbie was describing, was exercise. So we know through research that this is the thing that makes the difference, and this is what keeps us happier and younger for longer. So exercise, we know, is great for the brain, makes us feel happier, ages slower, improves our skin. It only needs to be a matter of a minute to the amount of exercise that we need to do, as Hazel explains. It helps us recover from major illnesses, and it shrinks fat cells. So obviously we can burn calories much better when we have a higher muscle mass and improves aerobic capacity. So there's no doubt that we need to maintain that 150 minutes per week, combined with some strength training and general stress management and improving our workplace relations will all help in reducing our musculoskeletal disorders. Ashley's just going to quickly run through kind of research in regards into exercise.
Yeah, if you want to just put them all up there, Paul.
Yeah, no problem.
So it's my job to talk about a little bit about the research, and Hazel's talked quite a bit about a lot of the research already, actually. So it's just kind of tying things together. There is one bubble in there that I'll see if you can spot it before I get to it. So the first bubble there. Exercise diminishes disability and pain severity and improves fitness and occupational status. So basically this is from a research paper that said exactly that. So it demonstrated that the more you exercise, the less pain you're in, the less disabilities you will have, and the more fitness and better work status you will have. All of these quotes have come directly from research, and it's interesting to see that Hazel has already mimicked pretty much everything that we've discussed here, as well as Robbie actually as well. So this second bubble is interesting, that general exercise are effective as sling or motor control specific exercises. So what this is saying basically is that any form of exercise is beneficial towards lower back pain. We know categorically that exercise is lower back pain, and there's still some discussion within the research as to which type of exercise is the most beneficial. You know, there's a lot of core stability things that get thrown around. You know, planking, strengthening, and what we know is that all forms of exercise tend to be as effective as each other. So even just, as Hazel said, going for a 30-minute walk a day can have the same effect as specific core stability exercises. So the message really from the physiotherapy profession is whatever form of exercise is most beneficial for you and fits into your life in the most convenient way is something that you should and could be doing, no matter how much, how acute or how chronic your back pain is. Exercise is good for it, and it's finding the right exercise for you that is key. Another study suggested that workplace physical exercise is more effective than home-based exercise, and this is the same for group exercises. So, if you can find yourself in a gym, as Robbie runs an EDAP, with guys from the workplace, or a general group class outside of work, like yoga, or the things that Hazel has mentioned, Pilates, or just going to the gym and socializing, it's more effective than sometimes doing it at home on your own because of that social element. And as we know, lower back pain isn't just the structural things that cause the pain. It's other things that Hazel's discussed, your mental capacity, your mood. So that social interaction can help in improving pain. Physical inactivity is associated with narrower intervertebral discs. So again, this goes back to what Hazel discussed, in that Hazel was talking about the fluid moving in and out of the discs in a sponge-like fashion. And what we found in the research is that the less you exercise, the less movement of that water there is in and out of the discs, the less healthy the discs are. They can't produce those nutrients. So the less you do, the narrower those intervertebral discs get, which can contribute towards continued pain. So it's really important that we do, as we've said, some form of exercise. And the last bubble there is the one that I said is a myth. And it's something we wanted to address because it's something that I hear, and I'm sure we all hear as physios commonly, that surgery is the first treatment I should have to make my back better. And this goes for scans as well, really. I'm sure we all hear this all the time. Patients, or you may have asked for one yourself, you go and see a physio or a doctor and you ask for a scan on your back to see what's going on, or you think surgery is the answer. And what we know is, and particularly with scans, is that we could scan 10 different people's backs. They could all look the same on the scan. 5 would be in pain, 5 may not be in pain at all. And it goes back to what most of us have said, in that there's a lot of different contributing factors towards back pain. It's not just what's actually going on in the back, so there's a lot of other contributing factors towards that past experience, as we've said, and all those other factors. Surgery, again, is a thing that hasn't always been proven to be the best first-line treatment. I think with any lower back pain, the first line of treatment should always be exercise-based, and surgery should really be the last option, not the first.
So it really seems to kind of all tie in, doesn't it, Ashley, that we know that exercise, without doubt, and as Robbie explained and as Hazel explained, is the big one in terms of helping prevent or manage any of these kind of back pain issues, and the research backs it up. So if we know that, then we can also show this, is that there is, as this research has shown, there is a definite reduction in kind of different illness or injuries, which shows here, so all-cause mortality, there's a 30% reduction associated with physical activity, so general exercise. And you can see through the line there, there's a very common linear risk reduction, but that's associated with that physical activity. And you can see an average is about 30% reduction in physical activity in all these different types of injuries or illnesses. So given that we know that, if you look at the next slide, which is quite interesting, and this was a research in Scotland with males, was that between 25 to 34 years old, we're 63% active. However, look at the dip when it gets to 65 to 74 years old. So that is a 24% people are only active. So that's a huge drop in the levels of activity. And it's really just trying to educate that although we don't have to exercise to the same intensity that we did when we were in our early 20s, so we can modify our activity to what we enjoy and we can tolerate happily, we still need to keep that activity, and that reduction in activity may certainly contribute or increase the risk of us developing these back pain issues. And interestingly, to the female population, there was even a lower percentage of inactivity in the older age group. So to kind of tie a lot of it up, what we need to do in terms of the maturing workforce is that we need to increase awareness and change the attitudes for the mature workforce. And that means changing the attitudes with the employer and with the employee, which is really important. So we need awareness campaigns that can disseminate benefits of the workforce that we briefly mentioned before. So there's definitely less incidents of absences, more experience, more knowledge that the maturing workforce can aid to employer. What is important, I know Hazel touched on this as well, as the employer has responsibilities, is that to provide additional support to improve that kind of relationship or attitudes between the worker and the employer, adjusting those workplace designs, the ergonomics of it, matching the functional capacity of the employee to the job demands of the employer, and improving overall job satisfaction cannot be underestimated. It's so important, and all those will without doubt help reduce the risk of musculoskeletal disorders. In terms of the employee, again, Hazel touched on it, was that, as we mentioned, the medical cure exercise, some sort of regular exercise, improving lifestyle, so we said diets, smoking, stress management, those type of things are so important. And again, it's up to the employee to communicate with the employer and developing that relationship. And also, as an employee, it's our responsibility to adhere to the health and safety policies. And once we get a matching of that, we will reduce your risk of musculoskeletal disorders as we get older. If you are looking to have IPRS Health as a facility within your workplace, we can provide you with assessments for current injuries, or we can provide you with exercise programs for prevention of any injuries or prevention of lower back problems. And we use a fantastic service. We have our own app that we use, that we do bespoke exercise programs depending on what is required for that particular patient. And we provide them in a video format with a full explanation. And this is an example of the type of video that you would, type of exercise template that you would see on your app on your phone. Really fantastic service that we have. So if you have IPRS Health in your own employment, use us, contact your line manager or your HR for referral. Because it is a really great service that we have for this. So that's kind of tying it up. We have, Hazel was just going to quickly mention, there are some resources to look up that may give you some more information and education in this area. Hazel, do you want to just share those resources?
Yeah, there's a lot of free resources available, but in terms of ones that are kind of robustly supported by research and clinical evidence, the first one I'd probably recommend is NHS Choices. They have an option for searching for back pain, and they have a guide on back pain and advice, a lot of advice regarding living with sort of long-standing back pain as well. And it identifies a lot of the jargon that is used in low back pain in sort of descriptive terms, so that you can kind of actually see what those medical terms actually mean, and with nice pictures as well, which is always a bonus. The other site that I really rate is Arthritis Research UK. They have a lot of funding invested into musculoskeletal pain and disorders, and they've got some really good evidence-based guidelines for back pain, which again are free, and you can upload PDF copies of a back pain booklet, which has some exercises in the back of it to use if you have an acute episode of back pain, and it just gives you an idea of what to do in the longer term to manage back pain and live with it if it's a chronic problem. The HSE website is also really useful. There is actually a section on back pain with advice for workers and advice for employers as well. So that gives you a lot of ergonomic advice and information, as well as gives you a bit of an idea of the risk assessments that people should be carrying out in order to make it safe to work in the long term and protect everybody really working within your workplace. So those are probably the three main ones that I would tend to use.
Great. We're just coming towards the end. We are at the end now. We're just running a couple of minutes over. But we're happy if anybody wants to ask a question. On your panel to the right hand side, there is a section where you can type in a question. So So if anybody has any questions, we'll keep it open for a few minutes just to see if anybody wants any questions answered. Bear in mind, we can't answer questions with specific, like your own specific injury history. We can only answer as a general recommendation or general education. So if anybody has any questions, just type it into the control panel on your right hand side there, and we'll try answer them. We'll keep it open for a couple of minutes. So we don't have any questions, which is fine. I'm just going to quickly check here. Not missed anybody. Right. Well, I think everybody's happy enough. There's no questions. So I just want to thank again Hazel and Robbie for coming on. It was really fantastic to have them on this webinar. There was some great motivation and feedback and information in regards to those two interviews. And also to thank Ashley for helping out with this webinar. You will get everybody who signed on and registered will get an automatic recording of the webinar, so it'll be emailed to you soon. So you will have that. And if you have any questions, please feel free to contact either myself, Ashley, or myself. So my email is paul.scallon@iprsgroup.com, and Ashley's email is ashley.james@iprsgroup.com. So you're more than welcome to email us if you need to. And that's it. Thanks a million, guys.
Thank you.
Thanks, guys.
Thank you, Paul.
Bye-bye.
Brilliant.